This updated longer-range forecast shows how the Omicron wave could evolve in the coming weeks as cases continue to accelerate across the country. It is important to note that this trajectory estimates the true number of daily cases as opposed to reported cases that may be occurring in Canada each day. Due to constraints on testing capacity, these numbers are much higher than can be detected. It far exceeds the number of cases reported in the surveillance data, shown here as orange dots. The two scenarios shown on the slide, both of which incorporate the impact of booster doses, suggest that the Omicron variant could cause a large wave that may peak in January and then recede into February. However, it's important to remember that these are modeled scenarios and the timing of the peak is likely to vary across the country. The red line trajectory shows that without recent strengthening of public health measures in many jurisdictions, the Omicron wave could have peaked at about 300,000 actual daily cases. Whereas the blue line trajectory shows that with the recent implementation of stronger measures, we could experience a peak that is lower, with about 170,000 actual daily cases. These scenarios highlight that while combined public health measures and booster doses could help reduce the size of the Omicron wave, in either scenario, the true number of daily cases driven by extremely high transmissibility of the Omicron variant could still vastly exceed anything we have experienced to date during this pandemic.
Diapositive 12.
Slide 12. This new modelization for new hospitalizations anticipated daily helps us understand how the exponential growth of cases could affect our healthcare system over the next few weeks. By supposing that the number of Omicron cases will follow the trend and the interior line of the previous slide, continuing with the current public health measures in many places in the country, this shows that both, including new daily hospitalizations. So the direction of the yellow line shows the potential impact on hospitalizations if the hospitalization rates for Omicron were as high as Delta. So the blue line shows the potential impact if the hospitalization rates were 40% of Delta, as the evidence is being showed for the gravity in Canada and abroad. This is the scenario, shows that even if we use the lower prediction for the number of cases and hospitalizations, it's much lower for Omicron. New hospitalizations could still go over the historical peak represented by the horizontal green line because of the high number of cases which could happen. It's important to mention that this only takes into consideration new hospitalization and not the total number of people hospitalization with a disease linked to COVID-19. But no matter what, we expect the number of hospitalizations, daily hospitalizations, to be a deep burden for the healthcare system over the next few weeks.
Experiences of other countries that also experience an Omicron surge provide additional insights into how the pandemic may evolve in the weeks to come. Countries like the United Kingdom and United States that experience a sudden and very steep rise in Omicron cases also experience a sharp rise in hospitalizations. However, given the lower severity profile of Omicron, hospitalizations haven't increased at the same explosive rate as cases.